Welcome to our 2026 Asbestos Awareness mock test. This test is designed for anyone preparing for their Category A or Category B asbestos training. The practice test will cover where asbestos may be found, the risks associated with exposure, and what you must do before starting work. Pause the video when needed, choose your answer, and then check it against the correct response. Let's get started. Question 1. What is asbestos? A. A group of naturally occurring fibrous minerals. B. A type of insulation foam. C. A synthetic building plastic. D. A type of cement. The correct answer is A. A group of naturally occurring fibrous minerals. Question 2. Why was asbestos widely used in construction? A. It was decorative. B. It was cheap and highly fire resistant. C. It was easy to recycle. D. It improved ventilation. The correct answer is B. It was cheap and highly fire resistant. Question 3. Which disease is most strongly associated with asbestos exposure? A. Asthma. B. Tuberculosis. C. Bronchitis. D. Mesothelioma. The correct answer is D. Mesothelioma. Question 4. How long can asbestos-related diseases take to develop? A. A few days. B. 1 to 2 years. C. 10 to 60 years. D. Immediately. The correct answer is C. 10 to 60 years. Question 5. Which type of asbestos was most commonly used in UK buildings? A. Blue asbestos. B. Brown asbestos. C. White asbestos. D. Green asbestos. The correct answer is C. White asbestos. Question 6. When was asbestos fully banned in the UK? A. 1999. B. 1995. C. 1985. D. 2005. The correct answer is A. 1999. Question 7. Which of the following materials may contain asbestos in buildings built before 2000? A. Textured coatings. B. Floor tiles. C. Pipe insulation. D. All of the above. The correct answer is D. All of the above. Question 8. What is the main way asbestos fibers enter the body? A. Skin contact. B. Swallowing food. C. Inhalation. D. Eye contact. The correct answer is C. Inhalation. Question 9. Which job role is most at risk of accidental asbestos exposure? A. Office receptionist. B. Electrician. C. Accountant. D. Graphic designer. The correct answer is B. Electrician. Question 10. What is an asbestos register? A. A list of trained asbestos workers. B. A record of known or presumed asbestos in the building. C. A list of banned materials. D. A demolition permit. The correct answer is B. A record of known or presumed asbestos in a building. Question 11. Who is responsible for managing asbestos in non-domestic premises? A. The local council. B. The building tenants. C. The duty holder. D. The HSE inspector. The correct answer is C. The duty holder. Question 12. If you accidentally drill into material you suspect contains asbestos, what should you do first? A. Carry on quickly. B. Cover it with tape. C. Try to clean it up yourself. D. Leave it and report it immediately. The correct answer is D. Leave it and report it immediately. Question 13. Which asbestos-containing material is considered higher risk? A. Asbestos cement sheets. B. Vinyl floor tiles. C. Loose fill insulation. D. Roofing panels. The correct answer is C. Loose fill insulation. Question 14. Can asbestos be identified just by looking at it? A. No, it must be tested. B. Only by trained electricians. C. Yes, always. D. Yes, if it is grey. The correct answer is A. No, it must be tested. Question 15. What is the purpose of asbestos awareness training? A. To train workers to remove asbestos. B. To help workers avoid disturbing asbestos. C. To certify demolition contractors. D. To replace a license. The correct answer is B. To help workers avoid disturbing asbestos. Question 16. Which regulation governs asbestos management in the UK? A. Health and Safety at Work Act 1974. B. Control of Asbestos Regulations 2012. C. CDM Regulations 2015. D. PPE Regulations 1992. The correct answer is B. Control of Asbestos Regulations 2012. Question 17. What does friable mean in relation to asbestos? A. Painted. B. Waterproof. C. Fire resistant. D. Easily crumbled and likely to release fibers. The correct answer is D. Easily crumbled and likely to release fibers. Question 18. Which of the following is not a common asbestos-related disease? A. Lung cancer. B. Mesothelioma. C. Asbestosis. D. Influenza. The correct answer is D. Influenza. Question 19. What should you check before starting work in a building built before 2000? A. Fire escape route. B. Asbestos register. C. Current CDM regulations. D. Asbestos management plan. The correct answer is B. Asbestos register. Question 20. Does Category A Asbestos Awareness training allow you to remove asbestos materials? A. Yes. B. Only small amounts. C. No. D. Only with supervision. The correct answer is C. No. Question 21. Which trade historically had high asbestos exposure? A. Plumbers. B. Roofers. C. Shipbuilders. D. All of the above. The correct answer is D. All of the above. Question 22. What is asbestosis? A. A skin rash. B. Scarring of the lungs caused by asbestos fibers. C. A type of infection. D. An allergic reaction. The correct answer is B. Scarring of the lungs caused by asbestos fibers. Question 23. Why is asbestos dangerous when disturbed? A. It explodes. B. It releases microscopic fibers into the air. C. It becomes radioactive. D. It produces toxic gas. The correct answer is B. It releases microscopic fibers into the air. Question 24. What personal protective equipment is typically required for licensed asbestos removal? A. High visibility vest. B. Safety boots only. C. Respiratory protective equipment and protective coveralls. D. Hard hat only. The correct answer is C. Respiratory protective equipment and protective coveralls. Question 25. If asbestos-containing material is in good condition and undisturbed, what is the usual management approach? A. Seal and manage in place. B. Immediate demolition. C. Break it up. D. Wash it down. The correct answer is A. Seal and manage in place. That's the end of this asbestos awareness mock test. If you need asbestos awareness training, there's a link in the description below. If you're pursuing a career in construction, we post free educational content every week, so consider subscribing. Thanks for watching and stay safe.